Well, over 700 COVID-19 patients have actually been discharged from Yuma Regional Medical Center since the start of the pandemic in Yuma County. But once again, discharges are not the same as recoveries. News 11's Aziza Schuler tells us how oftentimes additional care is required once a patient heads home and what to do if your family member was released too early.
We spoke to the daughter of a man treated at Yrmc with coronavirus who wanted to remain anonymous due to her relationship with the hospital. She claims her father was hospitalized for COVID-19 earlier this month, but discharged after just 4 days, leaving her mother, who tested negative, to care for her father, who she believes was still contagious.
Of course, we were very alarmed because, one, he was still coughing awfully, and he should have stayed in the hospital at least for another 5 days.
A local woman explains how her father's condition improved just enough to be discharged, but says his symptoms returned within a day of being home, something doctors say is not uncommon.
It does happen sometimes, like patients sometimes are feeling good on the time of the discharge. They may get worse. The symptoms may come back after a few days.
When a COVID-19 patient is discharged from the hospital, it doesn't necessarily mean they are recovered. Dr. Krishnam Nimagada cares for COVID-19 patients at Yrmc. He says discharges have nothing to do with bed capacity and confirms the hospital is releasing patients to their families once their symptoms have improved and oxygen levels have stabilized.
If they are stable enough to go home, then the treating provider will decide the patient. Sometimes they can just go home on medications. Sometimes they need oxygen, which we arrange if they need it.
But some families are concerned and even scared to care for their loved ones who are fighting this contagious virus, especially if they don't have a background in nursing.
You're discharging them, sending them back home to families who are not prepared.
Depending on the household, Yrmc assigns a case manager for discharged patients to assist with navigating continued care, at times recommending rehab facilities and nursing homes as alternative options, taking the burden off of the family.
We work with them via phone, and we're working with the patients and with the families. And so we find out all of this information, what the needs of the patients are, what's going on in the home.
Yrmc says doctors are following CDC guidelines when discharging patients. And if you think your family member was discharged too early, reach out to your primary care doctor. Reporting in Yuma, Aziza Schuler.
Aziza, thanks. This is deaths related